one. She's the only one not here. Okay? The alimentary canal, the GI tract, gastrointestinal tract is called the alimentary canal. Right? Yes, we ingest our food, it gets propulsion through the body. We break it down mechanically, we digest it, we absorb it, and then we get rid of the waste, right? We defecate. Yes? Okay. Now, let's talk about control of that. What makes us want to digest our food? Okay. Here's the stomach. Okay. Right. Okay, let's talk about long versus short reflexes. Okay? Okay. What in the heck does that mean? The long versus the short reflexes. Okay? Now, our GI tract's pretty smart. Do you think it needs the brain to tell it, I just ate 5 pieces of pizza. Do you think it needs the brain to tell it, oh, by the way, you probably should digest this food, right? No, The brain, the GI tract has its own network of nerves, okay? And sometimes they call it the gut brain, right? Everybody knows what chicken wire is, right? Yes, that's the way they describe it. It's like chicken wire, okay? And when those nerves get stretched, or when the acidity goes up or down, or osmolality, how salty it is, the concentration, right? That's going to signal it to digest that food, okay? Now, the long reflexes, right, from the brain to the tummy, yes? Have you ever looked through a magazine and they had the picture of the most yummy food and you start salivating? Have you ever smelled your grandmother's bread and you start salivating? You think about it and do. Yes, that'll get it started. That's the long reflexes. From here to here is long. But the tummy from here to here is short. Those are the short reflexes, right? That gut brain, it's called, right? And there are sensors for, as I said, acidity, osmolality, and all that good stuff. And these sensors tell us too, right? So it can be from the long reflexes, right? I should have drawn the brain. Yes. Right? From the brain, the long reflexes, from the stomach, right? I can't draw chicken wire very well, but anyway, the gut brain, okay? Yes, the long versus the short reflexes, okay? Digestive activity is provoked by a range of stimuli. Can be mechanical meaning I ate a bunch of pizza, my stomach is stretched, and the stomach knows, okay, better start digesting this, right? Or it can be chemical. The pH goes up or down and such, right? Stretch, osmolality, pH, right? Okay, when the receptors are stimulated, yes, it can activate or inhibit glands to secrete juices. It stimulates smooth muscle to contract and move food along, right? We're going to talk about peristalsis here in just a minute. The intrinsic controls, right, are the short reflexes, okay, and such. The gut brain, or whatever we want to call it, right? The short local enteric, okay? And again, we also have the long reflexes from the brain. We see food, we smell food, yes? Okay? Okay. Now, let's talk about chapter 1. We studied the parietal and the visceral peritoneum, right? The gut sac, basically, okay? Well, another name for that is mesentery. Mesentery, they use that term when they're talking about doing abdominal surgery, the mesentery, okay? And the mesentery helps to hold our guts in place, right? They're all tied to our spine through the mesentery, okay? The mesentery, we have blood vessels running through it, okay? The mesentery, we also have nerves running through it, okay? And such. And oh, by the way, the mesentery is a deposition for fat, right? Yes, the mesentery, okay? And so, in fact, we're going to talk about, there are two special mesenteries. One of them goes from the liver to the stomach, right? And it kind of holds the stomach up. And the other, and that is called a lesser, L-E-S-S-E-R, lesser omentum. Lesser omentum. Omentum means apron. Omentum means apron, right? But oh, by the way, if we look at it from the lateral view, right? Here's the stomach, here's the liver up here, and we have a mesentery that just kind of loops like that, right? Mesenteries are double-walled, and remember they secrete their serous membranes. They secrete fluid, right? So we don't get friction. They're slimy, okay? Right? And this big one that hangs down in front of the stomach is called, of course, the greater, G-R-E-A-T-E-R, greater omentum, the greater omentum, right? And that's what gets so big on men, right? They eat too many carbs, their blood sugar's high, their body converts it to fat, and it grows right here on the man, right? And that is because it's under hormonal control. But anyway, that's where men store fat. Greater omentum. Even me, I'm very trim everywhere, but if I don't eat good for a week or so, my stomach will start growing. It's very frustrating. But anyway, the greater omentum, okay? The greater omentum, yes? Now, when you fill it up, guess what? Then you start filling up down here. If you've seen people like that, way down low in their abdomen, they carry, that's because they fill this one up. But anyway, the greater and the lesser omentum. Okay. Now, those mesenteries, two serous membranes fused back to back. They're roots for blood vessels, lymphatics, nerves. They hold the organs in place, okay? They store fat, okay? They're also, if you get hit in the stomach, right, they lessen the blow. They absorb the shock too, okay? Most are attached to the posterior abdominal wall. Some have specific names, the greater and the lesser omentum, right? Now, next concept, intra versus retroperitoneal. Intraperitoneal and retroperitoneal. Okay, what does that mean? Intra and retroperitoneal. Intra, that A means within, okay? That's what A means. Inter means between. Intra means within. The intraperitoneum, guess what? Right? Those are the organs that are inside the gut sac, the peritoneum, okay? That's what intraperitoneal means. But what is retroperitoneal? What does retro mean? Dr. Weld, he's retro, right? He's from years ago, yes? Retro, behind, from years ago, blah, 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 okay? We have certain organs that are in the gut sac when we're an embryo. But then as time goes by, they move their way back and out of the gut sac, okay? Number one, kidneys, right? Kidneys, okay? When you cut the pig's kidneys out, were they wrapped in the omentum here? No, Now, the duodenum, or duodenum, D-U-O-D-E-N-U-M, the duodenum, that is the first 10 inches or so of the small intestine, okay? The duodenum. Duodenum, some people say duodenum. The first 10 inches. The pancreas, P-A-N-C-R-E-A-S. The pancreas is not inside the bag, it's outside the bag. And let me make sure I didn't miss one, okay? Let me make sure. Okay, the pancreas, duodenum, kidneys, yes, right? They were behind the peritoneum, okay? They were behind the peritoneum. They moved to the back during development, and when they move to the back, they started out inside the bag, but when they move to the back, that part of the peritoneum around them dissolves and such. Okay? Okay. So if you're doing an abdominal surgery on the stomach, then you got to get inside the peritoneum. But if you're cutting a tumor off the pancreas, you don't have to. If you're cutting a tumor off a kidney, you don't get inside the gut sac, right? Which is a very good thing, yes? Because infection is very, very, very serious in abdominal surgery. It's very serious, okay? It's a way bad thing, okay? Peritonitis, Peritonitis. Everybody knows itis means inflammation of. How do you get peritonitis? There's several different ways. Can anybody think of a way that you could get peritonitis?
Like surgery?
Surgery, yes, that's possible. Yes, yeah. But much more commonly, especially if you're a teenager, and the opening to the appendix is really big, right? If your appendix burst, right? What about this? Yes? Right? Freaking meanie, he didn't clean his knife before he stabbed you with it, right? So you got germs in there, yeah? What about lead poisoning, kaboom, right? That too, yes? They didn't clean their bullets before they shot you with them, yes? Mean people, but anyway, right? Anything like that can cause peritonitis. I had a patient, and she had a ruptured appendix, peritonitis, back in the 1920s, and she lived through it. But through her life, she had 4 or 5 surgeries to work on her. Her GI tract never worked that good since then. But anyway, right? Okay. And yes, if you're doing surgery, if you're not clean, if you don't have good sterile technique, or think about this, if I got an ulcer in my stomach and it ulcerated all the way through and the contents of my stomach came out in my abdomen. Contents of my stomach, probably not sterile, right? You've eaten that Sonic corn dog, admit it, right? Yes? Oh, just a minute, your corn dog's gonna be ready in a minute, I gotta take that autoclave. Yeah, no, I don't think so, right? Okay, but anyway, poor Joseph, he'll never eat another corn dog for the rest of his life. So, but anyway, okay. Let's also talk about the mucosa. M-U-C-O-S-A, right? The mucosa, right? That is the lining of the GI tract, yes? Okay? The lining of the GI tract, right? And remember, where the outside meets the inside, it's epithelial tissue, right? Epithelium. Right? And in the mouth, the esophagus, and the anal canal, it is stratified. Stratified squamous? Yes. S-T-R-A-T-I-F-I-E-D. Stratified squamous, right? Remember, stratified means layers, right? What would that be? Because if it was one layer and you're crunching on those sunflower seeds, right, you could crunch through it, yes? Right? Okay? So it's stratified squamous, where there could be some friction, or there could be some grinding, or there could be some rubbing, right? In the mouth, in the esophagus, or in the anal canal. And the rest of it is columnar, right? Now, the book in one place says simple columnar. Okay, in another place it says pseudo stratified columnar. Right? And remember, columnar is a tall, skinny, they look like a column, right? Like a skyscraper, yes? Simple is just one cell next to another cell next to another cell. Pseudo-stratified means you got a tall one, you got one that's not so tall. You got a tall one, you got one that's not so tall. You got one that's about 3/4 tall, then you got another tall one. And it looks like it's stratified, but it's really not. It's pseudo, meaning false, stratified, right? Okay. So, I don't know, it's been too many years ago. I took histology, so I can't remember. So, one of those two. Okay, either simple or pseudo-stratified, right? Okay, the mucosa, the innermost lining of the alimentary canal, It secretes mucus. It absorbs the end products of digestion, and it protects us against infection, okay? Because we eat germs, they pass through, and then they pass out, don't they? Pass out of the body, I should say. They don't pass out. I've never seen a germ faint. But anyway, okay? Page 746 in my book. Just a minute, I'll give you here we go. Figure 22.6 will show you the four layers of the 4 layers of the GI tract there, as in the mucosa, the inner layer, then the submucosa is the next layer, then the muscularis externa, the muscular layer, and then the serosa. And the serosa is another variation or another name for peritoneum, right? Serous membrane, okay? Now, I don't know why they threw this in. I'm just going to mention this. Okay? Right? We just studied the heart and the big aorta that comes off the heart and major branches and Well, the circulation that comes off the aorta to the abdominal organs is called splanchnic. S-P-L-A-N-C-H-N-I-C. Splanchnic circulation. Okay? That's to the abdominal organs, right? And that includes the hepatic portal system. Can you spell system, right? The hepatic portal system. The stomach and the liver hooked together, right? And they have a circulation called the portal circulation. And right, you drink a bunch of alcohol, and part of it's broken down in the stomach by alcohol dehydrogenase or something like that. But a lot of it is absorbed, goes to the liver, and there it's worked on in the liver. It's broke down to acetic acid, I believe. I'll think of it in just a minute. But anyway, that's a special circulation. And oh, by the way, if that circulation, if you have problems in the liver, we're going to talk about it in a minute, cirrhosis or non-alcoholic fatty liver, then stuff gets backed up, right? And you ladies are going to be nurses. You'll have a patient, and it'll be an old man, and he'll be really fat, have a pendulous abdomen, and around his belly button, you'll see all these varicose veins, right? And that's because pressure backing up into the liver, right? And these got swollen and big, and that's called caput medusa, right? Yes, is it Greek mythology, the lady with the snakes on the head that's going around, right? Medusa, yes. That's where that comes from, right? Okay, now, it used to be years ago, almost always cirrhosis of the liver was from alcohol, too much alcoholic. But now that's been overtaken by non-alcoholic fatty liver. Non-alcoholic fatty liver, we'll talk more about that, but basically you eat a ton of carbs and the carbs are converted to fat and the fat gets shoved into the blood and your triglycerides get high. And then if you keep shoving it in, you keep eating that, especially the worst is a high fructose corn syrup. High fructose corn syrup is really cheap and they put it in almost everything from Cokes to breakfast cereal to whatever. It's been shown it really puts the weight on here and such, right? But anyway, when you fill up your blood with fats and your liver gets fatter and fatter and fatter, and the good news is you crank way down on the carbs, and within about 2 weeks your liver's getting better, and within about 3 months your liver is almost like a normal person, okay? It's also associated with diabetes, considered kind of like pre-diabetic, okay? But like when I was in high school in the 70s, late 70s and early 80s, it's unheard of. And nowadays it's a major, major health concern, non-alcoholic fatty liver, even in young children, right? Because what do they feed little kids? Oh, drink your apple juice, drink the orange juice, right? All those juices, they take the fiber out of it and you still get all the sugar. And it's not healthy. It's not good, right? Just as much sugar in a Coca-Cola as a glass of orange juice, right? So every once in a while, I do drink just a little bit of grape juice, but like almost never orange juice. I just think that's almost like, but anyway. So, what is the guy's name? I'm going to think of the guy's name. He's very famous. He's written several books. He's a pediatric endocrinologist, and he says that those juices are poison. What is his name? Dr. starts with that L. I'll think of it in a minute. Anyway, you should watch some of his stuff. It's really good. It's very interesting. He's written books about it. And he's like extreme. You think I'm bad, he's extreme and such about that, because he treats all these children with a fatty liver. You know, when they're 13 or 14 years old, they're overweight and they got the fatty liver, and it's way bad. So he's that's poison. Okay, right. Okay, just a little bit of anatomy, right? The mouth, the oral cavity, also called the buccal cavity, right? We already said that's stratified squamous, right? The lips are called labia, right? The labia, right? Lips, okay? Now, the bottom of the tongue is the lingual, L-I-N-G-U-A-L. Lingual means tongue. Frenulum, F-R-E-N-U-L-U-M. The reason I mention that is it's a very common condition. That's the little thing on the bottom of your tongue that hooks the tongue to the floor of the mouth, right? And a lot of kids are born and they are what's called tongue-tied. Ankylosing, A-N-K-Y-L-O-G-L-O-S-S-I-A. Ankyloglossia. They're tongue-tied. And when they start trying to talk, their tongue is tied to the bottom, okay? So, depending on your pediatrician, some pediatricians say don't worry about it. It will normally rip itself and untie. And some of them go in there with the scissors and snip it. So that way, because you can't talk properly if the tongue doesn't move. If the tongue is tied down, you can't make proper sounds. Okay? But anyway, ankyloglossia. Ankylo means like fused. Glossia also means tongue. Okay? Okay? Now, let's talk a little bit about the salivary glands real quickly, and then we're just going to mention the parotid, okay? The salivary glands, right? They secrete, of course, the saliva, right? They secrete the saliva and such, and there are several of them. Mainly we're going to talk about the parotid. The parotid is right here, superficial here, and the big deal about the parotid is, right, we get the mumps, right, myxovirus, and it can swell up, right? It can swell up, and it hurts to swallow, and we have like a bad sore throat and such. And the big thing about the mumps is nowadays we take the MMR shot, but for it, so it's not very common. But the thing about the mumps is it's a parotid, P-A-R-O-T-I-D, right? Myxo, M-Y-X-O virus causes the mumps, right? And the thing about the mumps is, in about 1/4 of the boys, they have a phrase, it goes down on them, right? And what that means is this. Somehow it goes from here to their testes. Their testicles can become inflamed if they get the mumps. And if it's really bad, they can be sterile. Okay? So anyway, that's why the mumps for a little boy is more serious. But they swell up there, it hurts to swallow, you can't hardly drink anything and such. But again, that's the MMR, the first M is for mumps. Mumps, measles, rubella. Okay? Salivary glands, they cleanse the mouth, right? They dissolve food chemicals so that foods can be tasted. Okay? Right? We have the little taste buds on the tongue, more so to the back of the tongue, right? And such. And and such. They moisten the food. Some of the chemicals of the food go into the taste buds mixed with water, and that allows us to taste them. Okay? It compacts the food into what is called a bolus. This is important. A bolus. Bolus. It's a round ball, right? And you chew something up, and then you take your tongue, you lift it up, and you shove it against the roof of your mouth, and that makes a ball of food, right? And then we swallow that. It's called a bolus. Okay? It's also, if you have an IV in you and they give you a major shot of something, sometimes they call that a bolus too. But anyway, a bolus of food, okay? Goes into the esophagus. And the esophagus is shaped like this, right? And the esophagus is normally closed. And when that bolus of food hits, notice how it's almost like an accordion shape, and it will stretch out, and as those muscles contract, right, we get peristalsis, P-E-R-I-S-T-A-L-A-S-I-S, peristalsis, right? And that is the movement of food through the GI tract, peristalsis, right? And it starts when we swallow in, and the upper layers of that smooth muscle and ring squeeze, 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 and it pushes that food down into our stomach. Okay? Again, certain enzymes, salivary amylase to break down carbs, right? So when you chew that cracker, it's carbs. They're starting to digest right in your mouth. Okay? So that's why there is the question, where does digestion begin? Begins in the mouth. Okay? You also have some other enzymes too that are secreted to help break down fat, I believe. Okay? But the salivary amylase is the one they always talk about. Okay? Okay. Sorry, back to the mumps. How's it spread? It's spread through oral, right? Saliva. Yes. That's why little kids pass it from kid to kid to kid, especially at daycare and such. Okay? Okay. Saliva. 97 to 99.5% H2O, water. Okay? 6.75 to 7.0. Right? What does that tell you? 6.75 to 7.0. It's a little bit acidic. Okay? What is acid going to do, by the way? Right? What does the acid in your stomach do? One of the things it does. Right? Breaks down food, yes, yes, yes. But the acid too, acid kills germs, right? Acid kills germs, yes. So the saliva being a little bit acidic is going to help to kill germs, right? Okay. About 1,500 mils a day, 1,500 mils a day, right? 1.5 liter, okay, of saliva a day, yes? Okay. Halitosis, Halitosis. Halitosis is a fancy way of saying bad breath. Okay? Why do people have bad breath? Okay? Yes? On the back of the tongue, right? On the back of the tongue, right? There's a microbiome, by the way, right? In our gut, but also in our mouth, there's a microbiome. So there are certain germs that live there at the back of the tongue, and they produce hydrogen sulfide, okay? And you're like, hydrogen sulfide, what is that? You ever smelled a rotten egg? It's hydrogen sulfide, okay? And so that is one of the main reasons that people have bad breath. It is true, too, people with poor oral hygiene, they don't brush their teeth, they don't clean their teeth, they don't go to the dentist once or twice a year, right? And they develop periodontal disease and things like that. So that also, but one of the main causes is those germs on the back of the tongue, making that hydrogen sulfide, okay? Right? Now, that is one of the reasons, right? Every morning I scrape my tongue. Does anybody else scrape your tongue? Yes, okay. I have the metal one it's like this, right? 2 rubber handles on it. And as soon as I get up in the morning, when you sleep at night, you develop a film on your tongue, okay? A film, right? You get the morning breath, yes? So, first thing I do when I get up, let the dog out, come in, start getting cleaned up, is scrape that tongue. What does it do? It helps to get rid of those bad germs, okay? No, it doesn't hurt. It's normal and such, and it's very good for oral hygiene. It'll help get rid of the bad germs. And I can't swear to this, but I bet you it's helpful to get rid of those germs so you don't have cavities as much, okay? Now, you have also certain germs on your tongue and the cracks of the tongue that make nitric oxide, which is very good, right? And we already talked about nitric oxide. Blood vessels get bigger, and it kills germs, okay? But anyway, so that's good. But I was watching a program yesterday or the day before, and they talked about how scraping your tongue is very good, and it gets rid of the bad germs and does not get rid of the germs that cause the nitric oxide. And oh, by the way, they were talking about if you use mouthwash that has alcohol in it, right? It does kill germs. It absolutely does, but it also kills the good germs with the bad germs, right? And so I prefer, I don't hardly use the Listerine and such like that, right? I use one made by a dentist for people that have bad breath, right? Especially late in the evening, yes, right? When the wife gets home from work, right? Hey baby, how are you doing? I really don't want bad breath then, right? Yes. But anyway, yes, right? Newsflash, guys. Girls don't like it when you have bad breath, when you're sweaty, and when your hair's all messed up. Okay, so, right? That's not the time. Yes. So, but anyway, yes, I just threw that in because I like you guys. All right. Yes, salivary, intrinsic, saliva, parasympathetic. Okay. Parasympathetic, right? It's going to make our saliva come out. Right? Rest, digest, feed, and breathe. Yes, that's parasympathetic. That's going to make those salivary glands so we get ready to digest our food. Yes? Okay. All right. Masticate. M-A-S-T-I-C-A-T-E. Right? Masticate. Right? That means chewing. Masticate. To chew. Okay? Right? Okay. Now, this muscle right here that raises the jaw up, right? It is the masseter. M-A-S-S-E-T-E-R. The masseter, right? It raises the jaw up. It's very powerful. Otherwise, how could you go and crunch that ice, right? Have a sister drive me crazy when we were kids, chewing on ice, right? But anyway, the masseter, very powerful muscle right here. Also bad when you grind those teeth, right? Okay, thank you. Grinding those teeth, that's the masseter really working out. Yes? Okay? Okay. Now, let's talk about the teeth, all right? Let's talk about the teeth, yes? Now, we have 2 different sets, right? We have your baby teeth or your milk teeth or your primary teeth, right? Yes. And we have 20 of those primary, again, called the baby teeth or the milk teeth, and you get 11, 12 years old, they start falling out, right? Yes. And a full-grown adult's 32. Yeah, just making sure. 32. Okay. Oh, by the way, these primary teeth, yes? They're called deciduous. D-E-C-I-D-O-U-S. Deciduous. Okay? Right? Anybody take botany? Yes? there's two kinds of trees, right? Tell me the two kinds of trees.
Coniferous and deciduous.
Okay, deciduous is the ones that lose their leaves, right? And the others are evergreens. There you go, right? She used the fancy term, but anyway. Okay, deciduous, right? Deciduous, during the wintertime, the trees lose their leaves, right? Yes? When you're a kid, your deciduous teeth, you lose them. You lose your baby teeth, right? Interesting, they fall out, right? That's where that comes from. Okay? We have 32 permanent teeth, and a few people even have 2 more molars in the back. That's a cardinal sin, sir. Don't let that happen again, right? Don't let that happen again. Upsets me. Lose my train of thought, right? Okay, 32, third molars, right? Yes, wisdom teeth, yes? Okay. Now, dental caries. Dental caries, dentalcaries, is a fancy word for what? Cavities. Cavities, right? Cavities, yes? Okay. What happens is, again, you have a microbiome in your mouth, and when you eat carbohydrates, sugary substances, certain bacteria dwell on those, and they produce byproducts, and it's acidic, and that acid will eventually eat a hole in the dentin in your teeth, and you get a cavity, right? So, sugar does not cause cavities. It's the germs acting on the sugar that cause the cavities, basically, okay? Right? Now, gingivitis, 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 right? Gingivitis is red swollen gums, okay? Red, sore, swollen gums, okay? And if not treated, it leads to periodontal disease, okay? Periodontal disease, gum disease, right? Okay? Now, here's the thing. Up to about 95% of people, right, when they get over 35, have some amount of periodontal disease. Okay? Yes? Now, do I have any horse people in here? Any people who love horses and know about horses? No? Okay. When you go to buy a horse, you look the horse over real good. And the first place you look is where? In the horse's mouth, right? Yes? And you look at the horse's gums. Yes? Right? Because if he tells you, oh yeah, this horse is 3 years old, right? And you look in the horse's mouth and you see that a young horse is going to have the gums covering the lower part of the teeth. And when a horse is older, right, you're going to have recession of the gums. It's going to be much lower, right? Have you heard the expression, long in the tooth? You never heard that expression?
Nope.
Okay, Dr. Weld, he's getting long in the tooth, right? That means I'm getting older, yes? Because you look at the gums and the gums recede, okay? So if you pull this down, you'll see that my gums don't come way up like when I was 20 years old. They've receded some, okay? So it makes my teeth look, the bottom teeth look like they're longer, right? And that's an expression, long in the tooth. And if the guy tells you the horse is 3 years old and you look in the horse's mouth and his gums are all receded real bad, you know this horse is at least a dozen years old. And you know you're dealing with a liar and don't buy that horse, right? Yes? You go to buy something with anybody and they tell you a lie and you know it's a lie, don't, because nothing they tell you is going to be the truth. That's always been my policy, right? I bought a lot of motorcycles. I asked this guy, has this motorcycle ever been dropped? And he goes, yeah, my wife dropped it once. Well, every motorcycle's been dropped, but one of the reasons I ask him that, I know every motorcycle's been dropped, but one of the reasons I ask him that is because if he says, oh no, it's never been dropped, you know what? I'm talking to a liar, right? It's just, don't believe a thing he says, right? Because if he's not going to tell you about the truth about that, he's not going to tell you the truth about anything else, right? Yeah, it's like, oh yeah, I change the oil every 3,000 miles. Oh yeah, okay. Where's the maintenance record? Where'd you write that down? Oh, I didn't write it down. Oh, okay, yeah, right. Yes. Sorry, no, thank you. Yes. Okay. Periodontal disease. Okay. 95%, up to 95% of all people over 35, right? And 80 to 90% of the people that lose their teeth, many times it's because periodontal disease. Yes? Okay? Periodontal disease is much worse if you don't clean your mouth and take care of your mouth and brush your teeth regularly and such. Okay? Now, here's the thing. It's associated with heart disease too, by the way. It's associated with heart disease and stroke, bad teeth. Yes? Some people believe some of the germs from your mouth get into your bloodstream. Okay? Right? And some people believe, well, people that don't take care of their mouth, guess what? They probably don't eat good. They probably don't take care of their health in any way, right? Yes? And if you don't take care of your health in any way, you're probably going to get heart disease, right? Yes? Okay? The risk factors for periodontal disease. Number one, smoking. Smokers. Their gums recede real bad. They have a lot more trouble with their teeth. Diabetics. Okay, diabetes, right? Oh, by the way, yes, poke holes in your tongue and put metal studs and stuff. Guess what? Associated more with periodontal disease because there's going to be germs going on those studs. I'll never get that one, but anyway, I guess I'm old. I guess I'm way old for that, right? Yes, it's the same with I see these beautiful young ladies and they put holes in their face and they why did you do that? I don't know. Sorry, I shouldn't get off on that. Right? Again, the esophagus, right, we talked about, it's collapsed till we get that bolus of food. Yes? Right? Okay? Now, let's talk about GERD. Okay? Anybody got GERD? Okay? Okay. GERD. Gastroesophageal reflux disease. Right? Right? GERD. Okay? Now, what is that? Okay? Here's the esophagus coming down. Right? Stomach. You got a valve right here. Yes? And such, right? And what happens is, if this valve becomes incompetent, acid can come back up in your esophagus and burn your esophagus. Have you ever ate too much Mexican food and boy, that hot sauce was really, really, really hot? And then you burp and it burned, right? A lot of people will get this GERD, yes? Now, associated too with people that have the big, huge abdomen, much more commonly, right? Not always. A burning substernal pain when the stomach regurgitates acid. Regurgitates a fancy way of saying throws up. But anyway, the stomach regurgitates acid into the esophagus, okay? People that have the big abdomen pulls on that area, right? You got your diaphragm right here. Okay, pulls on that area, okay? Now, many times too, my older brother has this bad, and he's too fat. And what happens is that when this acid goes up, it irritates the bottom part of the esophagus. And there's a condition called Barrett's, B-A-R-E-T-T, Barrett's esophagus. And here's the thing, Barrett's esophagus, if you have that, they look down in the lower part of the esophagus and see it, and if you have that, you're more likely to have esophageal cancer, okay? My older brother, 4 years older than me, he has that, Barrett's esophagus, okay? Right? Okay. Now, let's talk too about part of the reason that people have trouble with this is that the pulling puts pressure on the valve, but also too, if you gain too much weight, it puts pressure here. And this part of the stomach will sometimes come up above the diaphragm. And when that happens, that is called a hiatal, H-I-A-T-A-L, hiatal hernia, hiatal hernia, right? The stomach is supposed to be below the diaphragm, not above it. And the thing about hiatal hernia, it will mimic all kinds of things. It will make you thinking you're having a heart attack. It will make you think you have all kinds of problems. It will mimic a lot of different things. Now, I've seen these on x-rays many times and such, and you will see that stomach sticking up above the diaphragm like that, okay? Weakness of the gastroesophageal sphincter, right? It's supposed to close. There are a very small amount of people that their esophagus, they're born with, it's too short, and that's why the stomach comes up, because it's too short. Okay? And it mimics heart problems, gallbladder problems, and pleurisy. Okay? Okay? A moment ago we talked about mastication is chewing, right? Well, deglutition, D-E-G-L-U-T-I-T-I-O-N, it's a fancy way of saying swallowing, deglutition. Okay? I don't have time. There's a lovely graphic in the book showing about swallowing and the bolus of food going down. And it'd be good if you looked at that. Okay? Now, let's talk about the stomach a little bit. Okay? Okay. Okay, if you look at the inside of the stomach, it has ridges called rugae, R-U-G-G-A-E, okay, rugae, however, right? And that is to increase the surface area, so we get better absorption, okay? Rugae, yes? Right? Okay. The parts of the stomach. Right here is called the cardia. The cardia, the fundus, the hole in the middle, right? The opening, that's the lumen. This is the antrum, and this is the pylorus, right? And this is the pyloric sphincter, right there. Gastroesophageal sphincter up there, but anyway. Okay? Rugae, longitudinal folds, okay? 1.5 to 3.5. What does that tell you is the pH? What does that tell you?
It's not very acidic.
No, just the opposite. It's extremely acidic, right? Remember? Scale goes from 0 to 7 to 14. 14 is basic, 7 is neutral, and 0 is acidic, right? And it's way over here, right? So the stomach is super acidic. We need acid to break down protein, okay? Acid breaks the little peptide bonds that hook the amino acids together, okay? So, might want to remember that, by the way, 1.5 to 3.5 pH, okay? I'm just saying, right? Okay. Now, okay, let's talk about some of the cells, okay? The parietal cells, P-A-R-I-E-T-A-L, cells. The parietal cells secrete the hydrochloric acid, HCl, hydrochloric acid. but also they secrete intrinsic factor. Okay, let's talk about hydrochloric acid. Got to have that HCl to break down the protein, we said, to break down the peptide bonds in between the amino acids, okay? Intrinsic factor. Intrinsic factor we got to have to absorb B12. Do you remember? If you as we get older, we have less acid in our stomach, we have less intrinsic factor, and certain people have an autoimmune situation where their body even attacks the lining of their stomach anyway. The B12. The B12 is the only B vitamin that is actually almost all the B vitamins, vitamin C, if we take too much, we just pee it out, right? But remember, the fat-soluble vitamins are A, D, E, K, right? Like a deck of cards. I always do that to remember spades, right? But anyway, not clubs, spades. But anyway, B12, yes? B12 is the only one of the B vitamins that we can absorb. And as we get older, in our 50s and such, many times we're not absorbing the B12. We have less acid in our stomach. And we get a condition called pernicious anemia. Pernicious anemia. It's an anemia, and some of our blood cells, again, I don't treat this, I can't remember exactly. I think that certain ones of the blood cells get really, really big, and the reason they get really, really big is because you don't have enough B12, okay? Now, the treatment for that, drop your pants, B12 shot, right? And then you can also take B12 sublingually underneath your tongue. It'll absorb straight into the mucosa. They make some of those preparations, okay? But this is very common, mainly among older people, okay? Pernicious anemia. You get tired, you get run down, they check your blood, and it's like, your blood is screwed up. Yes? Okay? Pernicious anemia. But anyway, again, from the intrinsic factor, okay? Now, we talked about the parietal cells, hydrochloric acid. I do this, pH for parietal cells, hydrochloric acid, also intrinsic factor. Yes? Now, the chief cells, CHIEF, the chief cells, right? The chief cells, right? They secrete pepsinogen, PEPSINOGEN. Pepsinogen becomes pepsin, right, in the presence of HCl, okay? Got to have hydrochloric acid. This pepsinogen becomes pepsin, and that dissolves protein. DISSOLVES, protein, PROTEIN, right? So you got to have acid in your stomach to digest the protein, basically, okay? And again, the chief cells, okay? Now, we have one other type of cell called enteroendocrine. Yeah. ENTERO, enteroendocrine. And they secrete histamine and serotonin. Okay, let's talk about that, right? Histamine, we know about histamine, right? Histamine is associated with inflammation, right? And vasodilation, and we get the runny nose. What do we take? Histamine, right? Yes. But oh, by the way, in our stomach, guess what it does? The histamine tells the parietal cells to secrete HCl so we can digest that protein, right? Interesting, huh? Histamine has a good function, right? Oh, by the way, some of the medications for GERD, they're H2 blockers, they're histamine blockers, right? If they block the histamine, then guess what? The parietal cells don't secrete the HCl. You don't have as much acid in your stomach. Okay? Right? Okay. The serotonin helps to contract the stomach muscles. Right? Serotonin, of course, the neurotransmitter. Okay? we said that the stomach acid is super acid, right? 1.5 to 3.5. And remember, it's a logarithmic scale. So from 1 to 2 is 10 times, right? And so why is it that the stomach's job is to digest protein? How come it doesn't digest itself, right? Because what's the stomach made out of? Smooth muscle, protein. Yes, right? How come that doesn't happen? Well, I'll tell you. Number one, there's a bicarbonate mucus with rich in bicarb on it, right? HCO3 minus, right? And what does that HCO3 minus do? It hooks up with the protein, right? Yes. So that's one way. Okay? So, number two, the epithelial cells, right, have tight junctions, right? Remember, the tight junctions are kind of like Velcro, yes? And the cells are really rough beside each other, and they're very tightly woven, so nothing gets in between them, okay? Right? And number three, the surface. Right? The surface is renewed every 3 to 6 days. Right? Every 3 to 6 days, you got a new lining of your stomach. Okay? Isn't that amazing? But it has to, because it's so bloomin' acidic. Okay? Okay. Let's talk about certain people get ulcers, generally in this area usually, and they're called peptic ulcers, P-E-P-T-I-C, right? Peptic ulcers. And I've had one of these, they're not fun. You have a gnawing pain, epigastric, right, around here in your stomach. And usually if you eat something or drink, I would drink a glass of milk, it made me feel better for a couple of hours, right? But then you get that gnawing pain again, okay? Gastric ulcers, usually it's an hour to 3 hours after eating. Then if you eat again, it makes you feel better. And let me explain. When I was a kid, everybody, what causes ulcers? Oh man, you are stressed out. Man, you need to change jobs. You need to do this. All this stress, right? Who's giving you a hard time? Right? That's what they laid ulcers off to. Yes? But the fact is, there was a gastroenterologist from Australia, medical doctor that was also doing research, and he kept looking through slides and he kept seeing this bacteria. And the bacteria looked like a corkscrew. Right? And he thought, I wonder if this bacteria, Heliobacter pylori, right? H. pylori. I wonder if that's the cause of ulcers, right? So guess what he did? He didn't have time for a clinical trial, so he did an experiment on himself, right? And he mixed some of that stuff up, and he did this. Look. And he said, if I'm right, guess what? I'm going to be sick pretty quick, right? And within 48 hours, geez, terrible. Gastritis. And he also, the second part of his theory was, and if I take this medication, it will kill that germ and I'll get better. And he took the medication, and guess what? And it just so happened, oh, by the way, he was going to a conference pretty quick, and he told a bunch of his friends that were gastroenterologists, you ain't going to believe this. I think ulcers are caused by this bacteria, H. pylori. And they're like, no, they're caused by, come on. Everybody knows they're caused by stress, right? Yes? No, they're not, for the most part, okay? They're caused by Heliobacter pylori. And about half the people walking around have that in their stomach. But of the half the people that have it, about 20% of those people develop ulcers. And the treatment is, they give you some old antibiotic. I forget which one, I'll think of it in a minute. See, my trouble is I have all these drawers and they're full of files and I have all this stuff up there and I just have to remember which drawer it's in. And that's what will happen to you by the time you're 60 years old and your brain's full too. But anyway, um, and they'll give you 2 weeks worth of this antibiotic. And the antibiotic, guess what it causes? Nausea, vomiting, stomach distress. But guess what? If you go through the 2-week trial period, it'll kill the H. pylori, right? And your ulcer will heal up, usually. Now, I've had several patients that were, in their 70s and 80s that had a stomach surgery because they had an ulcer that never would heal, right? But anyway, and they didn't know back then when they had that surgery, it's probably H. pylori. And if they would have, my buddy Kurt, my first climbing partner, he had to take 2 rounds of the antibiotic, and he said, man, I'm not sure that taking this medicine is not worse than the disease. The cure is not worse than the disease. But anyway, I got rid of it. Evidently now, if you go to the gastroenterologist, they can do this. Breathe into a tube, and they can tell if you got H. pylori by doing that. Isn't that amazing? Is that not amazing? But anyway, H. pylori. But I'm telling you, when I was a kid, people with ulcers, oh, you need to change jobs. It's too much stress, right? No, it's not. No, it's not. Yes, certain people. Stress affects everyone in different ways, right? Some people have a back pain. I get real tense and tight. I can give myself a headache, right? Some people, stress affects everybody in different ways. Some people get irritable bowels and they get loose stools. Stress affects everybody. You cannot separate that because we're more than just molecules, right? We're way more than just molecules, yes. But anyway, most people, if they will go to the doctor, he'll give them, dang, I wish I could remember that, I'm embarrassed. But anyway, only about 10 to 20% of the people that have that get the ulcers. Okay, they can give you a breath test now to detect H. pylori, and they got to give you about 2 weeks of antibiotics. Okay, so it's amazing, and it totally revolutionized the treatment of ulcers. Okay. What else can give you ulcers? Number 2, long-term treatment with NSAIDs, right? NSAIDs, non-steroidal anti-inflammatory drugs, okay? NSAIDs, arthritis medication, okay? Here's the thing. I'm not talking about, I had a headache, I took 2 ibuprofen. No, I'm not talking about that. I'm talking about when you take it for a long period of time. 2 weeks, 3 weeks, a month, right? It'll start bugging your stomach, okay? One of the most common reasons old people go to the ER is because they're tired and they're weak and they can't hardly get up and they move around. They check their blood and they're very anemic. Why? Because they ate a hole in their stomach and they're bleeding. And they're, I'm going to say it, sorry, pooping out their blood. That's what happens. It's very common because they hurt. They got arthritis. And their thing is, I take a bunch of Motrin, and they take it every day, right? And such. And so it's very common to cause an ulcer, and they get bad anemia from that. It's just very common, right? Now, NSAIDs are very serious, and I'm talking about if you take them for long periods of time, okay? Now, I bunged my knee in karate many years ago, and yeah, I took them for about a month, yes. But I'm like, talking to the orthopedic surgeon, I'm not really big on this, I don't really take that for a lot. He goes, no problem, I can do surgery, you want surgery? I'm like, no, okay, I'll try the medicine first, okay? And I did, and basically got over it, okay? Didn't have to have surgery on my knee, thank God. But anyway, so you have to be careful. Another thing NSAIDs do with long-term use is this. NSAIDs cause fissuring and cracks in your cartilage, by the way, right? So if you get cracks in your cartilage, guess what's going to happen when that knee is rubbing on it? It's going to wear out faster, by the way, right? Yes? Kidneys, yes? Kidneys. Especially naproxen, one of the most common one, naproxen, sodium, naproxen, right? Aleve over the counter, right? My friend Gary Johnson, we were talking one time. He's like, yeah, leave. Yeah, it works the best and it'll kill your kidneys, right? I had a patient, a young girl that didn't eat any food and she had a bad headache. And she took 2 Aleve and just enough water to swallow it. In the afternoon, she took 2 more. And the next morning, she took 2 more, right? And by the afternoon, her kidneys were killing her. She was hurting all through here, and they took her to the hospital. She ended up in Albuquerque with kidney failure, right? So it's very serious. NSAIDs are very serious, right? And again, I'm not talking about for a short time. I'm talking about if you take them for very long, okay? Do they decrease your pain? Yeah, about 25%, the studies show, right? Guess what else decreases your pain? Go for a nice walk, right? Outside, right? People say, oh, my knee hurts, I can't walk. No, your knee hurts, you better walk, because if you don't, it'll get stiffer, stiffer, stiffer. And let me explain. A joint that's free and slides doesn't hurt. And a joint that's constricted and won't move, guess what? That joint causes a lot of pain. Have you ever seen a little lady in church? She turns around like this, and when she turns her neck very far, she goes, because it hurts, because she grimaces, because it hurts, right? Because those joints are stiff, right? That's part of what we do, is we restore motion in those joints. As chiros, that's our deal, that's our thing. Nobody does it like we do. We're specialists, right? Yes. The PTs are great. They do a lot of stuff we don't do, but they don't manipulate what like we do. We get right on the joint and make that joint. We take it to its range of motion and then a little bit more. Sorry, not the commercial. But anyway, we're very unique, right? Yes? Okay. But anyway, NSAIDs. I had a patient, I was about to give him a treatment. He was related, he was the father of a young lady that I went to church with, and he was visiting, and the back was killing him. And he said, before you work with me, he says, I need to tell you one thing. He says, I only got 1 kidney. I said, you only got 1 kidney? He said, yeah, I had kidney cancer years ago. They cut 1 out. Well, I always ask him, what medicine are you taking? I said, well, did you tell me you're taking naproxen? Yes. Every day? Yes. I said, you're telling me you have 1 kidney and you're taking naproxen every day? Yes. I'm like, well, I am not a medical doctor and I do not take people off medication. That's unprofessional conduct or whatever, but you need to go back and talk to your medical doctor, because if you're going to take something every day, you need to take something that's not going to kill your kidneys near so bad, because that naproxen is very hard on your kidneys and you only got 1. He's like, whoa, I didn't know that. I'm like, I guess I could see giving it to him for, he sprained his ankle, here, take this for a week or 10 days, but no, he was on it constantly, every day, a drug that would kill his kidneys, according to my friend Gary Johnson, right? The pharmacist. So scary, yeah. Another story, I had a patient that he took his dad to the doctor for his annual physical, and he told the guy, he's in his 80s, he said, yeah, I'm stiff in the mornings. And the doctor said, take 2 Motrin every morning, So it was like 2-3 years later, he took him back, to do another physical, this and that. And the doctor says to him, are you still taking a Motrin? He said, yeah, you told me to take 2 of them every morning when I get up in the morning. He said, don't do that, it's damaged your kidneys. See, that's what happens when you take it for a long period. Now, I'm not talking about, I got a headache, I took 2 Motrin. I'm not talking about that. I'm talking about when you take it for long periods of time. It's very serious. But they sell it over the counter in big bottles about that big around and about that tall, right? And when they sell it like that, people think, oh, it's no big deal. It's like candy. It's like, what's M&Ms? What's it going to do, right? And they don't realize they're little by little killing their kidneys. What happens to our kidney function the older we get, as a general rule, not everyone, but most people, what happens to our kidney function? Here, right? That's what happens. You get 50, you get 60, you get 70, right? And it's way up here when we're 20. Yes? Right? So, Oh, by the way, who has a lot of trouble with their kidneys? Diabetics, right? Diabetics, the sugar, right? Yes. So I'm saying it's not a good thing. But anyway, just realize that. Just because it's over the counter doesn't mean it's not serious. Like I said, I had to take it for a month, right? But it's that or surgery, so I did do it, right? Because I figured that's the lesser of two evils, right? But anyway, okay, so that's the only thing, realize that, okay? Oh, by the way, people that have the GERD we were talking about many times, the medications for that, it's amazing. It makes them feel better. It makes them feel better quickly. First, they came out with a Tagamet and the Nexium and this and that, right? Yes. What are those associated with? Kidney failure, dementia. I don't want either one of those, right? And again, it's one thing if you take it for a week or so or something like that, but when you take it, my older brother with the Barrett's esophagus, he takes the purple pill every day, every day, every day. You know what? He's frying his brain slowly, little by little by little. That's what's going to happen. I know what's going to happen, right? Yes, but he doesn't exercise enough. He doesn't eat good enough, right? And he's always 4 years older than I. He's always carried 20 or 30 pounds right there. And so he's always pulling. He had the surgery for the hiatal hernia. It didn't take him 6 weeks. He ripped it. They had to do it again. Okay, so he's had 2 surgeries there and still has to take it. But anyway, it's a serious thing, right? Throughout your life, you take the smallest amount of medicine that you possibly can. Okay? I'm not saying don't take it or anything like that. I'm saying you be conservative. You take the smallest amount because kidneys and liver got to break that down. And it's cumulative. The effects are cumulative. Right? They accumulate kidney damage, liver damage. But anyway, okay? So, yeah, I someday the drug companies can get sued over people with dementia. But anyway, okay? Infants, right? Infants have an enzyme called renin, R-E-N-N-I-N, right? This is not the renin-angiotensinogen, right? Remember we talked all about that. Renin, angiotensinogen, aldosterone, that mechanism. Yeah, it has nothing to do with this. R-E-N-N-I-N, renin, right? It helps them break down the milk protein. The milk protein is called casein, right? It's milk protein. Right? Babies are nasty, right? If you've ever been around babies, they throw up little curdy looking white stuff. Yeah. That is casein, right? Looks like soured milk. Yes. Okay. The stomach. The only function of the stomach that you have to have, right? The only function of the stomach that you gotta have is the secretion of that intrinsic factor. So you get the B12. Okay? I had one patient, he was a skinny guy like me in his 80s, right? But he had most of his stomach cut out when he was a kid, right? Let's say when he was a kid, when he was young, from bad ulcers and such. Okay? So now let's talk about this. Let's take a break for just a minute. I'm going to go get a drink, and let's take a break for just a minute. Let me turn this off. Don't let me forget to turn that back on.